Today, we're going to talk about taking control of your healthcare costs. In this video, I'm gonna put you in the driver's seat. You have a lot of resources and choices, although you may not know them all. As always, I'm going to invite you to consult with a licensed agent like myself that can actually guide you through this process. You don't have to do it alone, but for now, I'm going to share with you some tools for transparency that I share with a lot of my clients that will help you be a little bit more empowered about the choices that you make. So the first tool is Healthcare Blue Book. This is a website that I learned about when I first started working as a licensed agent. And what this website does is it gives you the tools to be able to see what the fair prices are of procedures, medical procedures and treatment in your area. Whatever you need, you can actually look up and it'll give you a range of prices. And also it stays up to date. And so that's the thing with health insurance, and not just health insurance, but healthcare costs is really what we're talking about here, that they change so much and they vary so much from zip code to zip code. The same procedure at a hospital can cost way more, it probably does, than at like an outpatient clinic. And so using a tool like this and really digging in there can just help you feel a lot more empowered about making your choices. Another tool that I love sharing with my clients, in fact, when a client gets approved for a health plan, we send this to them automatically, like right away, along with their little welcome email. They get the tool of GoodRx.com. Now, I love GoodRx. I use it myself all the time. I have a little app in my phone that's for medical stuff, and they have an app. So I download that into that folder and I use it a lot. So what GoodRx does is you can search for the prices of prescription drugs. And so like, let's say you are taking or are prescribed a certain medication, you can put the name of that medication with your zip code on where you're at. It'll give you all the different prices, like the cash prices at the different pharmacies in that area. And you'll be amazed at how much they can vary from pharmacy to pharmacy. Sometimes it'll be a way better deal to go to the supermarket and use the pharmacy there, where you would never think of that. Some people only go to one pharmacy. I will go to wherever the price is cheaper, because why pay more for something when you can pay a little bit less across the street? So GoodRx also will tell you what a drug is being used to treat, and it'll tell you if there's, let's say you get prescribed a brand name drug, it'll tell you if there's an available generic drug, which you always wanna, obviously look at getting a generic drug rather than a brand name drug if you can, just because it's gonna cost you a lot less. But it'll tell you, you can look up all the drug information there too. It'll tell you the side effects, what the drug is commonly used for. And so that helps you be more empowered, not just about how much the things cost, how much it costs, but it will help you to be more empowered and knowledgeable about what questions to ask your doctor. And so, again, putting you back in the driver's seat of your health. So another recommendation that I give my clients is to inquire. So like this whole thing about the lack of transparency, it's really because like most people just don't know what certain healthcare services cost. And when we have insurance, it gets a little bit more confusing because the cost of what it is, if you were to pay cash versus the cost of what it would be if you were to go through the insurance, it could be a little bit confusing with different plans. And so I always recommend to my clients, when they have a certain plan and they get the quote for whatever procedure it is that they need through the insurance, to always ask what the self-pay cost is, or the self-pay rate, or the cash rate. Because a lot of times for the same procedure, it'll be cheaper. Like they'll give you a better deal if you pay cash than if you were to go through the insurance. And you probably are asking, why would I want to pay cash when I have insurance that should cover something, right? I mean, yeah, but in reality, if you have a higher deductible plan, or the procedure that you need is like a lower cost procedure, and you have a deductible, you're going to be paying toward the deductible. So you're going to pay through the insurance the whole cost. And it actually might be more that way than if you pay cash. So always inquire what the self-pay rate is, and you'll be surprised to find out that things are a little bit less expensive when you pay self-pay. And that's that will help you be just an empowered consumer of health insurance. If you have a PPO, let's say like the plan that I have for my family and the one that I do for a lot of my clients, it's an underwritten PPO. When you have a PPO, it will give you a provider discount. And then, so for staying in the network, if you're in the network, the PPO network, you're going to get this provider discount, which will cut down the price of whatever the doctor billed. And then you also will probably have a benefit amount. So like in my plan, I have a PPO discount and a benefit amount. The benefit amount is a lot easier to understand because it's in my plan documents. It's what the insurance company gives me. It's the dollar amount that they're going to pay toward whatever given service it is. Now the PPO discount it can be a little bit tricky. Talk about lack of transparency. I've found such a huge range with the PPO discount. But if you, let's say you're going to have a procedure and you have a plan like this, you call them and ask them, what is the contracted rate or what is the PPO discount? The contracted rate or the PPO with the PPO discount applied will be a certain amount. And then if your insurance also pays a benefit, a dollar benefit like mine does, you would then put that amount and subtract it from the PPO, from the contracted amount. And that's what you can plan that you're gonna have to pay out of pocket. It sounds a little bit complicated, but doing this at the beginning, before you get your procedure will give you a lot of more insight. And that way you're not just like sitting there waiting for the bill, hoping that it's not too high. And so this whole talk about transparency, there are some things that you can do as a consumer to be able to lower the chances that you end up with like this big bill that then you have to look at and understand. If you have a minor emergency, try to see if you can get treated at an urgent care center. A lot of urgent care centers can treat minor emergencies. The doctors or the physician assistants or nurse practitioners that are running those are trained to do that. A lot of times they can do imaging. That's something I'm seeing a lot. Imaging, if you have a fracture or anything like that, they'll be able to do the x-rays right there. And so not only will it be cheaper if you go to an urgent care rather than an ER, but you'll probably get seen a lot faster that way, because if you think about it, an ER has to treat all the emergencies, even the big ones. And so, they're gonna attend to you kind of in the order of importance. It seems like common sense. So always try the urgent care first. Another thing that I've learned and I've seen with all of my years helping clients is that if you have to do imaging, like for, let's say, a mammogram or some kind of like a uterine ultrasound or something like that, it's better off cost-wise if you go to a imaging center that specializes in only that. Like this is the case for colonoscopies as well. There's centers that just focus on colonoscopies, and so they do them and they offer cash prices for very reasonable amounts. And especially when you compare them to like doing a colonoscopy at a hospital or doing a mammogram at a hospital, you'll end up with a lot bigger bill if you do that. So I've given you just some resources, and there's this huge library of information in my mind from all my clients' experiences and all the years. And so if you need guidance with this, either with your health insurance or just trying to understand pricing and wanting more transparency with your family's healthcare, reach out to me. You can find me at alexthehealthagent.com and also follow me on Instagram. I've got lots of videos that are educational, like this one hopefully was. And if you found this video helpful, I would love it if you shared it, and please comment and subscribe.